Yeah, thanks very much. So, as explained, I'm Liz. I lead whole of workforce health and wellbeing at Lime. You're probably sat there wondering, who on earth are Lime Global? Lime is a technology-driven, purpose-led insurance, health and wellbeing business. And what we do really, really well is use technology to bring really affordable, accessible health and wellbeing benefits to all staff. We make those benefits super simple and super relevant, so they can be offered to the whole workforce at scale. Why am I here? Well, I would love to share with you our thoughts on really the amazing power of making workplace health and wellbeing benefits available to everybody, rather than just the privileged few and those who earn the most, which is typically where private healthcare is available, normally to those at the very top of the organisation. Before I dive into slides, which I've got some, don't worry, it's not just this, I'll share with you a story, if I may. Is there anyone from the aviation industry in here before I get started? Okay, good. Okay. So we don't have any aviation clients, and this is genuinely a personal story, but it will become clear why I'm telling you this in a minute. So I have a friend who works for a very well-known aviation firm. They wear red outfits and they do a lot of dancing. So she works for Virgin. Again, they're not one of our clients, and she absolutely loves working for Virgin. There are many other aviation firms out there who I'm sure are excellent. And for the longest time, she was really candid that, nothing would drag her away from Virgin. She absolutely loved it. Roll forward a few years and, a bit of a bumpy time, and of course she got poached for a higher salary, promise of a more senior role. We've all seen that or experienced it ourselves. And lo and behold, 6 months later, when I caught up with her, sort of post-pandemic, she was miserable. She absolutely hated it. I won't disclose where she went. And I asked her why, and the thing that really, really stuck with me is she just said that she just felt invisible. She didn't feel recognised. She just felt like a cog in a massive machine. And she'd lost her work mojo, and, the joy had been sucked out of her working world, and by extension, the joy had been sort of sucked out of her broader life. And it was sad to see. And lo and behold, roll forward another 6 months, she's back at Virgin. And in her mind, that is exactly where she belongs. And why is that? And why am I sort of telling you this? It will become clear. Virgin are one example, there are many, of a business which really treats its staff with respect, treats its staff brilliantly. And that's not just diversity and inclusion, it's genuinely recognising individuals as exactly that. But that extends across its culture, across how it's structured. But crucially, and for the purposes of today, particularly in terms of how that firm are leveraging employee benefits across all employees and really, really using them to great effect to make employees feel engaged and motivated. And it's probably no surprise that Richard Branson talks about Virgin Atlantic staff as his secret sauce, which I hate that expression, it's just wrong on many levels. But, Virgin staff are the key component, this is his words, that deliver that really stellar customer service that Virgin are known for and synonymous with. And so despite a really turbulent couple of years, and the aviation experts in the room will probably be nodding their heads, it's been pretty tough. I was quite interested to see that Virgin have just recruited 800 cabin crew and 150 pilots. And, when Richard Branson and his colleagues talk about recruitment, applications are vastly in excess of vacancies, and that is pretty unusual right now, and particularly for travel, and aviation, and a lot of other sectors are struggling to fill vacancies. It's completely the inverse. So Virgin Atlantic are clearly not the perfect employer, that doesn't exist, but what they do really, really well is they make sure that every one of their employees feels recognised, rewarded, empowered, and employee benefits, particularly health and wellbeing benefits, when you sort of dig below, plays a really, really crucial role in how they do that. And I think that's pretty cool. So I just wanted to share that with you. I hope you found that interesting. I didn't know what to call this slide, and I quite liked the picture of a lamp, so I thought I'd call this the light bulb. And there's a few stats on here. And these are the sorts of things that at Lime HQ we're sort of discussing every day. And some of these stats may well be familiar to you, some of them might not. I'll start at the bottom. So 100 million, it's quite an eye-opener. Cost of strike action on the UK economy in 1 month of this year, 100 million quid. That was June, in case you want to know, and since then it's got worse. 1.2 million is the number of vacancies currently in existence in the UK. I think it's actually 1.25 million, if you want to pull me up on that. And that was just in Q3 this year. 19% is the average UK staff turnover rate, and £3,223 is the average cost per hire. And those figures come from the Society of Human Resources Management, if you want to follow up on those. And 80%, that's the number of employees that, according to Harvard Business Review, would choose additional benefits over a pay rise. Now, that sort of predates cost of living crisis, so I would take that with a pinch of salt. But I think what these stats sort of suggest, there you go, you've got them on there. What these stats sort of suggest, and hopefully they are, is that replacing and recruiting talent in your organisations takes time and money. It's disruptive. You guys know that. And in most businesses, a bit like Virgin, it is the people that are the secret sauce, particularly where you've got businesses struggling with that transition of bricks and mortar to online and trying to have that dual, hybrid model. People are the secret sauce that make those businesses tick. Yet, when you look at a lot of businesses, health and wellbeing benefits in particular are not being effectively or equally leveraged across the workforce. So there's really an inequality when it comes to people's health and employees' health and wellbeing. And at Lime, we're purpose-led. We think it's time that changed. So tackling health inequality, so making benefits fairer, making them less hierarchical, and we believe that has a really positive, lasting impact on some of the toughest issues we're facing into. Now, I'm going to apologise for this. I'm going to put this up there because you're probably all sick to death of hearing about cost of living, but it would be remiss of me not to mention it. There are, wherever you work, whichever part of the industry you work in, whether that's employee benefits, human capital, talent, human resources, recruitment, kind of wherever you work in whichever sector. I don't know about you, but it feels like at the moment there's a bit of a maelstrom happening and it's giving me a headache. I'm sure it's giving you all a headache. And, not least, we are facing into some pretty tough stuff at the moment. Certainly our clients and our prospects are telling us this is the stuff that's keeping them awake at night. So cost of living, we know, we really don't need to tell you this, but it's putting acute pressure on employees, on businesses, in virtually every sector. It's having a profound impact on short to medium term budgets, particularly employee benefits. Skills shortages, we know, it's affecting and impacting productivity. It's hampering growth. Move on. And particularly at the moment, that growth is much needed. I don't know about you, I turned on the radio this morning and the first thing I heard, literally when I opened my eyes, was more strike action being announced. And it feels like that is pretty much industry agnostic right now. I think if you roll back, say, 10 years, you pretty much knew which industries may choose to strike or ballot their members on strike action. But, we're seeing nurses and midwives striking. And, it's affecting, this sort of turbulence is affecting the economy and society in ways that we've just never seen. It's sort of creeping into all different organisations, all different types of businesses, and that really should tell us something. And I think this bottom one, it tells us that in the main, a lot of employees, particularly those on modest or low incomes, are feeling pretty disconnected, disenfranchised, disengaged even. And that's a pretty sad state of affairs. I'm sure we've all heard the words burnout and quiet quitting. We just heard it in the previous presentation. I'm hearing that in the discussions we're having with clients on a daily basis. And that is a really, really tough place to be in. But there is some good news. So that's the doom and gloom slide out the way. So we'll move on. You're probably sat there going, okay, so these are some really big ticket items, right? This is some really tough stuff. So where do employee benefits come in? In this sort of maelstrom of stuff that's swirling around, where do health and wellbeing benefits fit in? Can fairer, equal benefits really make a dent? Well, yeah, we sort of think so. And hopefully you're sat there thinking, okay, maybe they do. Let me try and convince you. So when we talk to clients, we talk to them about sort of 6 main topic areas, if you like. Most of these will be familiar to you. So how to align your culture to your strategy, diversity, equality, inclusion, employee engagement, ESG, but particularly for us, we talk about the S in ESG a lot, data and risk mitigation. So this is the stuff that we're talking about with our clients all the time and the stuff they want to come and talk to us about, which is great. And for the purposes of this, I'm just going to focus on these 3. So the S, so social, societal. in ESG, diversity, inclusion, and equality, diversity, equality, inclusion, and employee engagement. So I'm just going to focus on those three for now. So, where was I? Yeah, so when we talk about these issues, we are talking about these in the context of how can you leverage more equal health benefits to drive organisational change. And it comes down to these three topic areas. So if we talk about the S in ESG, so social or societal impacts, what Lime is really, really good at is making private healthcare really accessible. And we do that through leveraging our technology to make healthcare and wellbeing genuinely affordable to more of the workforce. So we simplify the products, we strip out the stuff that we don't believe is needed, we digitise everything to drive out efficiency, and essentially what that enables, what we're left with is genuinely affordable products which employees can offer to all of their workforce, not just their top earners, not just their top 10, 12, 15%, which is the traditional domain of private medical insurance. And doing that, we believe, does sort of two things. It drives positive social change by alleviating pressure on the NHS, but probably more importantly than that, it removes fear and uncertainty from thousands, if not hundreds of thousands of employees who otherwise would be completely reliant on the NHS for all of their care. And with the NHS under such pressure, bridging that gap, helping employees bridge that gap between some of the provision that is available through the NHS and the state and provision which is available privately is really, really important. Fairer whole of workforce healthcare, certainly from a DE&I perspective, it's a really powerful statement. So that cultural impact shouldn't be understated. It's a powerful statement of prospective hires that you're looking to bring in from more diverse groups. It levels the playing field. It sends a very clear signal to all employees that they matter, regardless of their background or their starting point. It gives them a fair shot at promotion, at career progression, without being hampered by poor health or ill health, whether that's mental or physical. It safeguards resilience, irrespective of pay grade or seniority. And we think that's really, really key. And the last one, engagement. It's a bit of an obvious one, but, removing the hierarchies that exist within employee benefits, particularly health, is a really, really, again, it's a really clear statement, but it also helps you make your employee engagement a hell of a lot simpler, a hell of a lot more effective, and a hell of a lot more impactful. If you walk the walk, talk the talk, actually a lot of times, if you aren't aligning your benefit strategy to your, for example, DE&I goals, that becomes glaringly obvious. It's a really, really important step. Fundamentally, hopefully you're getting this, is that at Lime, whole of workforce healthcare really does support all employees to become more resilient, more productive, and more engaged, which right now feels more important than ever. So employee benefits really aren't the magic bullet. It's not what we're saying. We're not saying you wave your magic benefits wand and all of a sudden all of your business ills go away. That's absolutely not what we're saying. But when we think about those really, really tricky issues that we started with at the beginning, cost of living, disenfranchised employees, they can play a role in tackling some of those issues. And they can be surprisingly effective. So if we think about cost of living, we've talked already about reducing the sort of burden on public provision. But this is genuinely about how do you help employees that don't have access to any sort of private care, that can't afford to access a GP privately because there's a 3-week wait to see a GP. How do you help those people? Well, actually introducing really fair, equitable benefits, particularly from a health perspective, it reduces the worry. It reduces the worry of ill health for those employees that have no other choice. Because what we're hearing is that those low and modestly paid workers are worrying about the impact of taking time off work or having to take extended time off work because they can't get the treatment they need. This has a real impact, not just at individual level, but at societal level as well. So skills shortages, we talked about in terms of productivity and growth, that also has an impact on the rest of your workforce that are bridging the gaps and, the empty seats, and they're doing, 3 or 4 times the work that perhaps they should. So from a stress and burnout perspective, actually using benefits to potentially widen your recruitment pool, close that skills gap, can be incredibly effective. It's certainly something that we're seeing with our clients, that they are really reaping the rewards of making those benefits much more much fairer. We talked about strike action. I mean, irrespective of what role you do, what industry you work in, health and well-being, shouldn't be hierarchical. It shouldn't matter what role you perform. Actually, health and well-being should be prioritised. And so, essentially, regardless of where you work or what you do, we know that healthier, happier employees is intrinsically linked to better organisational performance. And lastly, that those individuals who are feeling disengaged, disconnected, being able to simplify and amplify employee engagement really is proven to build trust and reduce friction at all levels of the organisation. That shouldn't just apply to your senior managers. That should go from top to bottom, bottom to top. Okay, and again, probably sat there going, yeah, but private medical insurance is really expensive. I mean, the private bit, right, is a bit of a giveaway. That's true. In a lot of cases, and certainly for a lot of industries, we know that private medical insurance is cost prohibitive, between £400, £500, £600, £700 per employee. It makes it very, very difficult to offer those types of solutions to all employees, as much as you'd love to. We know that with budgets under extreme pressure, it's even less likely at the moment that companies will be able to afford to do that. And actually, you might be sat there thinking, well, we've got some cheaper, more reactive stuff in place, but it never gets used, or it just collects dust, and we have to remind employees time and time again to kind of use it. Absolutely. So, yeah, all right. Yeah, you're kind of halfway right, but yeah. So what Lime have done is create something called On Call. And I'm not going to do the sales pitch for On Call, because what I want to do is just put this into context in terms of how technology is helping us bridge gaps for those employees that desperately need it. So I said right at the start that Lime is a technology business. And we use our proprietary tech stack to really create simple products that are genuinely affordable. And I'm talking from £2 per employee per month. So this is not, right, I've got the 5-minute sign, thank you. This is not about replicating very high-cost private medical insurance. This is about breaking it down into its component parts to make it super accessible and affordable. When we do that, it takes away that cost barrier. So employers really can afford to roll stuff out to all of the workers in their workforce, those underserved employees that traditionally can't access. And to give you some context, we've put Lime right in the middle of this continuum. It's I guess a cost complexity continuum. And whilst our products aren't right down on the far left-hand side, they're certainly not far right on the right-hand side either. They sit somewhere in the middle. But because they are digital, and because what we've tried to do is simplify our products down, we can hand on heart say that because they are as simple as possible, they're much more likely to be used across the breadth of the product, not just certain bits of the product. And that's really, really important to us. And as you'd expect, all of our products and services are digitized to help employees use them as often as they need to. Before I close, I just wanted to bring cancer into the discussion. So we've recently been developing our On-Call Cancer proposition, and this is about bringing whole of workforce cancer coverage to the mainstream. Traditionally, again, cancer coverage has been pretty much ring-fenced to those that have access to private medical insurance, and we think it's time that changed. Oh, come on. There we go. So at a really high level, you'll have seen the news about increasing strain on NHS provision. We know from our own conversations that employers are really struggling with knowing what to do about cancer care for the whole workforce. And we know that the solutions that are out there are either really, really expensive or just not quite hitting the mark. We know from our own research that employees want more support from their employer. Over a third of them, 35%, have zero, not a bean of formal support should they be diagnosed with cancer. We know that they want emotional support for them and their loved ones, and we also know that financial support and diagnosis is really, really important. So that's been borne out in both our primary and our secondary research. We know that the additional costs of cancer on diagnosis are around £570 per person per month, which is a staggering amount, combined with cost of living crisis at the moment. It feels an awful lot, particularly to employees on a low or modest wage. So what we've created is essentially a strategy for the employer to help embed that into their business. This goes beyond simple procurement. This is about ongoing to support to properly embed it into the organisation, and data and feedback to really make sure that you know that your employees are using the stuff that you're providing for them. And for the employee, really, really simple financial support, which on diagnosis, a financial package to cover those additional costs for the first 12 months of their diagnosis. We pay that in one lump sum. And experts on hand for them and their loved ones if they're diagnosed. And these are cancer nurses, cancer specialists on call around the clock for the employee. Because we know that that employee, their line management community, their colleagues will all need that support. And so that is the model that we're building out. And because we're technology-led, it enables us to bring that to market at a price point which, so far has not been seen before, which is fantastic. So that's it from me. I'll leave you with 2 final points. We use technology to make healthcare benefits genuinely democratised, affordable and inclusive. And with that cost barrier removed, it does mean it is now possible for employers to expand their reach to more of the workforce than ever before. And that's it. Thank you.